enter the room.
It's begun.
Okay,
You
we'll
can start.
start.
Yeah.
Hello,
Hello.
I'm Dr. Firoz. I'm one of the doctor calling from this acute orthopedic department.
Hi. Hello,
Okay,
doctor.
so yes, I understand that you are related to Catherine Melton. So can I confirm your name, please?
Yes, my name is John. John Malton. I'm her son
Okay,
actually.
okay. So John, I have been calling you to talk about your mom. So before that, is it right time to talk?
Yeah, I'm all right to talk.
Mm-hmm. Okay, so before we proceed further, just want to make sure that I'm talking to the right person. So can I confirm your mom's age?
She's 91 years, doctor.
Okay, and her first line of address as well?
Oh, we stay in 123 Manchester Street.
Okay, okay. So John, I have been calling for your mom's current condition. And before that, I just want to ask you what is your understanding about your mom's condition?
Oh well, she basically had a fall like 5 days back,
Mm-hmm.
and
Okay.
they did some tests like they did a X-ray or something, and they gave her some painkillers, and they sent her home saying that she'll need some physiotherapy. After which the physiotherapy had started, but then she still complained of pain, and it was pretty bad. So we went to the hospital, and just 2 days back they did a CT scan, and
Mm-hmm.
yeah, I mean, when we did the X-ray the first time, the nurses mentioned that it was all normal, but yeah, the pain was still there, so that's why we did want to understand what was going on, so we did a CT.
Mm-hmm. Okay. So when was the last time you visit your mom?
Well, she actually stays with me.
Okay.
Hmm.
Okay. And before this fall, was she completely okay?
Yeah, she was absolutely fine. She was walking around. She was doing her
Mm-hmm.
daily activities. Yeah.
Okay. Okay. So I'd like to ask a few more questions about your mom. Like, does she have any medical condition?
Well, she doesn't. She has been diagnosed with dementia.
Mm-hmm.
Hmm.
Okay, and any medication she is taking right now?
Just for the dementia, she's been given a couple of pills.
Any blood thinner medication?
Oh no, nothing like that.
Mm-hmm. Okay, and how about her mobility? Like, is she able to walk alone before? Was she able to walk alone before?
Yeah, yeah, I mentioned that, right? She was able to walk
Yeah, okay.
around, and she did a lot of activities on her own. Yeah.
Okay. Does she have any kind of joint problem?
No, no, nothing like that. Just the dementia, doctor. I mean, she didn't have anything else.
Okay. So are you the next of kin?
Well, I am her son and the one and
Hmm.
only.
Okay, and does she appoint anyone as a lasting power of attorney as well?
That would be me, but why are you asking me that?
Yeah, I just want to make sure that to just take that all this information. Okay, so John,
Mm-hmm.
as we understand that your mom came to the hospital and we initially after a fall and we did the X-ray and after that she went back to that nursing home and you mentioned to me that she was still having that pain. Okay, and then we again did that CT scan.
Mm-hmm.
Okay, and about that CT scan report, there is something went wrong. Okay, like
What do you mean wrong?
usually what happened whenever we did any CT scan or any X-ray. So, in that CT scan report, it shows that your mom had this fracture on her leg, and initially we did the X-ray.
I'm sorry, what do you mean
There it was
fracture?
written.
You mean her bone is broken? And that's something that you found in the
Uh,
CT scan?
yes.
All right. And why an X-ray couldn't pick it up?
Yes, unfortunately, that CT scan, when CT scan report shows that she has this fracture, then the radiologist again reviewed this X-ray, and I'm sorry to tell you that it was mistakenly given as a that there was no fracture.
I'm sorry, what? Are you trying to say that, there was a mistake from your side?
2 minutes remaining.
Did you actually make a
Understand.
mistake in my mother's, findings? How is this
Yeah,
possible,
I
doctor?
understand.
How could you have missed a fracture?
I understand that I understand that it's really frustrating, and in your anyone in your position will feel the same way. And actually, it is
Absolutely, they would
mistakes
feel
from
the
our
same way.
part.
I cannot condone this. I want to make a complaint. How could you have missed this? Something this big? No wonder she's not able to walk. In fact, I think the physiotherapist must have worsened her condition. They were just forcing her to walk. I mean, an old lady with
Yes.
dementia, how could you have done that?
Yeah, we are really sorry about what happened to your mom, and it's actually from our side it's mistake, and as it is a mistakes, yeah, we will try to make a incident form about this incidents, and then usually in when we will file any of this as a significant incidents, hospital usually take this kind of incidents very, and then they try to do the investigation. Okay. After the investigation, they will take the necessary steps.
I want to
Okay,
make a
will
complaint, doctor. I cannot condone this. You cannot ill treat a person, this old. I want to make sure that I make a complaint and I'm heard.
yeah, definitely you can do that. For that, we have another independent department in the hospital. This is
Move on to
called
the next
Patient
station.
Advisory Liaison Service. So you can just go there and you can make a
All
formal
right, time
complaint.
is up.
Okay.
I have this call. Yeah, yeah,
Sorry,
sure,
sir.
sure.
Yeah, that's.
Hi,
Hello, sorry.
doctor.
I, I hadn't because I'm in the that house is I'm alone. That's why I need to go on.
That's all right, no problem.
Okay.
Okay, it's okay, we understand. All right. Good performance.
I didn't go to the management part also.
I know. I'm telling you, Breaking Bad News and Angry Patients are one of the most difficult stations, and they are 100% going to come for your exam. There is always one station from Breaking Bad News and Angry Patient. But once these two cases are over, you can breathe.
Okay.
Because they are the most challenging because the simulators act crazy. You don't know how they'll act. They'll just act really mad, or they'll start crying and all. They'll be like the most emotional state that you can find them in. But but that's all right. You kept your cool, you kept your calm. That was very good. But again, over here, I think you are finding it difficult to break the news,
Okay. Yeah.
because over here you have to be very transparent. You have to, from the beginning, you have to tell them that there is a mistake. I mean,
Okay.
beginning of what you're trying to disclose. So in a way, this
Okay.
is also Spike's protocol, if you think about it, because you're understanding the setting, you're understanding, perception. You did those two very well. You're giving an invitation, there has been some new development in your mother's care, right? Because you can't tell them that it's current condition. I made a
Okay.
mistake. I told you that she stays with me. She actually stays in the nursing home. You were
Hmm.
right. But yeah, it was information that was given in the question itself. So good job on picking that up. That was a mistake on my end. But sorry for that. You did not get
No, no,
deterred.
it's
But
okay.
always try to make sure that you stick to what you know. And what you know is what is given in the candidate information. If at all you're confused
Okay.
about a certain point, look into the candidate information and check it out. Understand what it is. And yeah, that was a
Hmm.
very good question on you didn't know who you're talking to. Very good. Because
Hmm.
if you're going to call somebody, you don't know who's going to pick up. If you think
Yeah.
about it, you know the patient identifiers, but you don't know who you're talking to.
Okay.
So ask. I'm from so and so thing. I'm
Hmm.
calling regarding so and so
Hmm.
patient. You know, can I know if you're related to her? So they'll only
Okay.
give you all the information. All right. I just need to thank you for confirming that. I need to ask you a few more identifiers if that is okay. Age and the first line of address. So this will be given to you in a different sheet. There'll be another sheet like this
Hmm.
where the information will be given to you so that you can cross check. Sometimes the person you're talking to, their name will also be there. So you can always cross identify. These are all identifiers. These are all given to you. So you have to make sure that they match. The person you're talking
Okay.
to is the person that is given in the whose information that you have, right? But you asked that clearly. Telephone etiquettes, good job. Can you hear me clearly? And because you are calling, you need to ask them, is this the line I can get back to you on if I get
Okay.
cut? Because that's again a safety netting. What if
Okay.
something like that happens, like you get a call again, so they go like, okay, yeah, I have a call, I'll call you back, and then they just cut the call, but you have some important information which you haven't given, because you have to safety net for any situation. So ask, like, is this a number that I can get back to you on? Is this a good time to talk? Can you hear me
Okay.
clearly? You know, so, because if they are calling you, that will be an important question. If they are calling you, asking you that I want to know about my mother's condition, then you'll be like, yes, I'm here to answer your queries. If just in case, if this line gets cut, is this a number that I can get back to you on? Right? Those are all
Okay.
kind of etiquettes, telephone etiquettes that you need to follow. Just like, hi, hello,
Okay.
my name is so and so. So that's the basics that you need to do for telephone. Good job. Hmm. Now let's look at the information that you have. Good job on asking perception. Perception was good, where you asked, can you please tell me what has happened so far? Right? If you want, I can even put the in-time guide for you so that you get an idea of
Okay.
how to do the consultation. So this is that we've made on the OSCE workbench. If you do have time, I know you have only just 10 days. I know that's too less.
Yeah.
If you're really confused about a case, you can tell it to
Okay.
us. If you're not sure about a certain case,
Hmm.
if we have it in our brain bank, we can populate it for you and you can go through the cases. You can get an idea of
Okay.
how to conduct that consultation. So if you see, even in this case also, it will be a spikes protocol because you're understanding the setting, you're understanding the perception, right? Summarize the sequence of events leading to current situation, right? So you need to understand how much they know. So she'll be like, yeah, this happened like 5 days back. They did an X-ray. They said normal. They said just take painkillers. They sent the physiotherapist. He did some physio work, but she couldn't do anything. So we went back and they did a CT, and now we're waiting for the results. So this is what the perception is. You understood what has happened so far. Either they may give it to you in one go, or else they may give it to you in bits and pieces, for which you have to ask the relevant questions
Hmm.
to make that perception clear to you, what has happened so far, right? But that's a very good question. Like, can you please tell me what has happened so far? Can you please tell me what is, how much you know about your mother's condition? Those are very good because that's open ended. So they may pour out their heart to you. If you ask open ended
Okay.
questions, they'll tell you a lot of things, right? But then if you ask specifically, like, was this X-ray done?
Hmm.
Then they'll be like, yes, it was, because that's the only answer you're getting. So try to get
Hmm.
as many open ended questions as you can, because as soon as you go closed ended, you'll only get that particular answer, right?
Okay.
All right. So that's why ICE is very important for all the symptomatic cases.
Mm.
What do you think it is? What is your concern? What are you expecting from this consultation? Those are all open ended. More open ended questions you ask, that much information you will get in a way, right? Yeah. So stick to
Yes.
the open end. It's very good. And yeah, invitation. There has been some important information about your mother's condition that I need you to know. That is one way to say that.
Okay.
Or you can say that there has been some development in your mother's condition that I'd like to discuss with you, right? Because
Mm.
all you're saying is that I want to tell you about your mother's current situation, current condition.
Okay.
It's not current, it's always been the condition. So that you're
Okay.
finding it out now, if you think about it, right? So I
Okay.
want to say about some discovery that we've made. Instead of saying discovery, say some development that has happened in your mother's condition. Technically, it's discovery, right? So
Okay.
you're like kind of making it sound professional, or how it's. I have some important information about your mother's condition, right?
Okay.
Current condition, they know what it is because she's staying in the nursing home. He goes to
Yeah.
visit
Okay.
her. He's in pain. You're only asking about the current condition, right? So as you know, if it comes, so setting, now knowledge. Now knowledge, we've understood perception. Now you have to break down the knowledge. As you know, there was an X-ray done, and it was, okay. So this is where you are finding it a little difficult to how to
Yeah.
phrase.
I think I started in a opposite way. I should have started from the X-ray. Then it
Because
would
that
be
is the
more
first
better.
thing that has happened. When you're
Yeah.
layering, try to follow chronology. Because
Okay.
this is the first thing that has happened, and then this happened, and then this happened, but uh, there has been a mistake, right? And then say what the mistake is, right?
Okay.
So if you see, now let's just go through that, the chronological sequence of events. That is a very good way of making the knowledge, layering the knowledge. Like, as you know, your mother had an X-ray of the hip to check for any fractures. Initially, we told you that the X-ray was normal. So that's not saying that initially you are taking responsibility. From the beginning itself, you have to start taking responsibility because this was a mistake on your part, right? So you have to acknowledge that this was our mistake. Even if you're losing your biopsy, even if you're losing the blood test, there is also a humerus fracture. In the beginning itself, you have to acknowledge the fact that initially when you came, we did an X-ray and it was called normal. We called it normal,
Okay.
right? So we told you that the X-ray was normal. Unfortunately, she continued experiencing pain, for which a CT was performed, which revealed a fracture of the femur, right? And then the initial X-ray was also reviewed by the radiologist, and it turns out that there indeed was a
Mm.
fracture that was missed. So we are taking responsibility from the start,
Okay.
right? So you're
Yeah. Understood.
happened. This is the sequence of events that has happened, right? And then pause because you told them that there's a
Yeah.
because you kept on
Okay.
saying a lot of things. You're not giving me an opportunity to talk. So
Yeah.
once you start feeling that you're talking a lot, you're losing that station for sure.
Okay.
Because ultimately, your entire thing is not to give knowledge, is to understand what the patient wants to hear.
Okay.
That's why ice is also important, because even if it's a case of the subarachnoid hemorrhage in the last thing, you could have explained so much about subarachnoid hemorrhage. I could have spoken about berry aneurysm, how berry
Mm.
aneurysm is related to hypertension, how if you're not taking medications properly, or even if you're taking medication properly, you can still bleed into the brain. I can go on about berry aneurysm for a half an hour session, but that's not what the patient wants to hear. You have to be very crisp about that, like we made a mistake and this has happened.
Mm.
Pause. Then they'll be like, how could you have done that? I'm so sorry you feel this way. And I'd like to tell you that it is completely our mistake and we take full responsibility for that. I offer you our sincere apology from me as well as our team, right? And then the whole thing about I want to make a complaint, like, yes, absolutely, as it's your right, and I will help you in doing so, right? Because you have to be
Hmm.
as apologetic as possible. You should be like, if you want to make a complaint, please make a complaint. I'll help you do that so that we don't do it again.
Okay.
I promise you, I'm never going to do that. Basically, you're trying to say it in that way, but you
Hmm.
have to give it a professional, covering.
Okay.
Like, I promise
Okay.
it will never happen. Trust me, this was my mistake. I get it. This is the emotion that you have to, bring about in a professional sense.
Okay.
Right? So, right. So initially, when you say that, so then perception, emotion, the E protocol, SPIKE. E will be very bad. E will trust.
Yeah.
You will feel nervous. You will be like, "Oh my God, when is this station going to end?" Trust me, just get through that E. Somehow get through that E. I will give you everything. I'll give you the necessary information
Okay.
that you want about PALs. We have services where you can make your complaint. We will make an incident report, making sure that this doesn't happen again. This will go to the authorities. They will review the case to make sure that this doesn't happen again. We will conduct an internal investigations. Our seniors are also involved. Give everything to the E, whatever you can, especially when you know that the mistake is from your side. You have to give them everything in your arsenal. Like, whatever I can do for you, I will do for you, because it was
Okay.
our mistake and we are so sorry, right? Because after that they will calm down. Because obviously when you tell me that I'm really angry at you, I'm like, I'm so sorry that you feel that way. Is there anything I can do to help? I mean, I'll help you if you want to make a complaint. Then they will calm down. And then
Hmm.
the next thing is strategy. What is going to happen next?
Hmm.
Right? So, yeah, since this has happened, it will be reviewed by the specialist, the
Hmm.
orthopedist, and they will decide for a further treatment plan, which most likely
Hmm.
might be a hip replacement, surgery,
Hmm.
that they will have to look into the scans, and they will make that call, because you're still only a GP, right? So you're going to tell them what can possibly happen. In my knowledge, I know that this will usually lead to a hip replacement surgery, but that is a call that the surgeons have to make. That's basically what you're trying to tell them,
Hmm.
right? So
Okay.
let's see how we can tell them that your mother may need a hip replacement operation, which will be confirmed after a review by the consultant, right? So this is most probably this is what's going to happen, but that is also something that the specialist or the consultant takes a call on.
Okay.
Yeah. So, and the medical error, this usually comes in the E part of it, where you go like, as soon as you tell them that I'm so sorry,
Hmm.
this was a mistake, crazy, crazy. And then you'll be like, yeah, you have this, you have that, you have patient liaison service, you have,
Hmm.
incident report. I will make
Yeah.
sure this happens again. I'm so sorry. I would like to apologize on behalf of the entire team, everything. Yeah, and then call them
Okay.
for a follow up. So now the next thing is safety netting and follow up. So this is something that we tell every student as soon as the 2 minute bell rings, like, start wrapping up the station. So when you wrap
Hmm.
up the station, you can say that I know this might be a lot for you to take in. So I'd like to set a follow up so that if you have any further doubts or queries, I can be there to answer them, right? So let's see what's the setting of this situation. The setting of it is you are in the orthopedics department. So you can either call them in the orthopedics department or you can tell them to go to the GP, right? So,
Okay.
so since you have made a mistake, try to call them back, right?
Okay.
So, and leaflets and pamphlets. I'll give you a little more information about your mother's
Hmm.
condition. We have leaflets and pamphlets that we can offer. And safety netting. Try to make sure that she doesn't walk around so much. We will send
Hmm.
the physiotherapist with the development of your mother's condition so that they can
Hmm.
give the right kind of care for your mother, right? Because right now,
Okay.
since there was no fracture, they might make her walk. Obviously, if you don't have a fracture, they will try to make her more mobile. Now they know there is a fracture,
Hmm.
then they will not make that area mobile, right? So
Okay.
so that's what you need to do: leaflets, pamphlets, follow up, and safety netting. Yeah, 2 minutes bell. Awesome. All right. Yeah.
Okay.
How are you feeling?
Oh, I know it's a very okay.
That's all right. You finish your Breaking Bad news, you finish your Angry Patient news, you can take a breath.
But this was pretty good. Like compared to the first station, the second station was really good.
Yeah,
Yeah.
I know because at this point you did the setting and perceptions very well.
Yeah, I understand.
So that was pretty good. Let's look at the examiner checklist. Oh, amazing. Look at that. You covered everything.
Everything, yeah. Only thing is the management section you missed a couple of
Yeah.
things, but other than that, it's fine. You delivered the news perfectly.
And then arrange follow up, yeah, and safety netting. That's something that you miss.
Okay.
Introduce yourself. Even almost everything was done. Yeah, signposting was important because you're trying to, whenever you change the
Hmm.
subject, whenever you're trying to say that I'm going to talk about this, give them a little
Hmm.
heads up. Now I'm going to talk about your mother's condition. Can you tell me a little bit
Okay.
about what has happened so far? Now I'd like to talk to you about, some developments that we've had about your mother's condition. Now there's a little signposting before you actually drop the news.
Okay.
All right, I think this section was pretty good, but always try to also make sure that there are some for 10 points that you get marked on. So if you're listening properly, because
Hmm.
at one point I had to tell you twice that she is walking,
Yeah.
so you will get marked for listening in those things. So you
Okay.
have to be very attentive. Because if you're going to repeat the questions that I've already asked, then
Hmm.
you get marked for it. But then once you realize that you got that, you can be like, I'm extremely sorry.
Okay.
I'm sorry to ask you that again. Then you would probably
Hmm.
not get marked for rapport because then it
Okay.
feels like you're not genuine. You're not listening to me. Are you not listening to me? I already mentioned that. Like I'm so sorry. I might have missed that. Thank you for reconfirming that information or something like that, just to somehow bounce back.
Okay.
Please like and subscribe to Turing Med School. Good luck with your preparation.